afternoon, my beloved viewers and my followers across the globe. It's me again, Ishmael MBITHI. And as you know me, I've been bringing to you healthy talks on different topics. And those who follow my channels, that is YouTube, TikTok, you have been able to see the kind of content that we have been uploading. And I want to thank you for journeying with me and supporting me. I'm very grateful. So today I want to present to us a very important topic, and it is ectopic pregnancy. As you can see on my whiteboard, ectopic pregnancy, and I have made a diagram for the purpose of illustrations and the correct demonstrations. So today I want to speak about ectopic pregnancy. And therefore, I want to start by asking a question. What comes in your mind when you hear about ectopic pregnancy? Have you ever heard about ectopic pregnancy? Maybe you have heard or you have not heard, but today I'll be taking you through this important topic. So, ectopic pregnancy is whereby a fertilized egg gets implanted in another part outside the uterus. And before we continue, let me name my diagram here. So, this is ovary. This is oviduct. This is cervix. This is vagina. What else? This is uterine cavity. This is called the fundus of the uterus. Yeah, this is called the fundus of the uterus. So, ectopic pregnancy is a scenario whereby a fertilized egg gets implanted in another part apart from the uterus. It can be implanted. This layer is called endometrium. And this is the fundus. So implantation takes place in the endometrium part of the uterus. So ectopic pregnancy now is a scenario whereby this implantation takes place in another part apart from the uterus. Now, where is this egg? The role of ovary is to produce ovum. Ovum is the egg. Ovum is the egg. Now, when a woman has an unprotected sex, sperms are deposited in the vagina. These are sperms. These are sperms. So the sperms will swim. The sperms will swim, and they will meet. The ovum also will move, and they will meet at this point. This is the point where fertilization will take place. So the sperms and the ovum will meet here, forming what? A zygote. After fertilization, zygote is formed. So after this fertilization has occurred, now implantation should occur in the uterus, in the endometrium. Most of the times, posterior part of the fundus, posterior part of the fundus, the endometrium. So ectopic pregnancy now is whereby this fertilized egg has not been implanted in the uterus. Are we together up to that point? And for you to know that this is a serious case, in the UK, in the United Kingdom, 1 out of 90 pregnancies are ectopic. This is a statistic from the United Kingdom that One pregnancy out of 90 pregnancies are ectopic. And this translates to about 11,000 pregnancies per year. This translates to about 11,000 pregnancies per year. Hope you are following me. Now, as we continue, I want to let you know that not every time ectopic pregnancy will present with clinical manifestations. Not every time that ectopic pregnancy will have signs and symptoms. But if symptoms start appearing, they start appearing between 4th to 12th week of pregnancy. So in case we have symptoms, they will start appearing, or we'll start seeing the signs and symptoms at the age of 4th to 12th week of pregnancy. So not every time we have signs and symptoms. So I am going to discuss the signs and symptoms, but before then, have you understood the ectopic pregnancy concept? Now, I'm going to talk about the etiology. Etiology is the cause. What causes ectopic pregnancy? So we are going to look at the causes. Okay, let me use this part. So the etiology. Everything that happens must have a cause, though not everything that happens as a known cause. Some of the causes are idiopathic, meaning the causes are not known. So I want to discuss about what really causes ectopic pregnancy. And number one is damage to the fallopian tubes. So these are the oviduct is the fallopian tube. So there might be a damage in that part. So if there is a damage, it means the process of fertilization is going to be affected, and also the movement of the fertilized egg is also going to be affected. And therefore, what can cause the damage to the fallopian tubes? It might be because of infections. Infections can cause damage to the tubes, and the most dominant infection that can cause damage to the fallopian tubes is PID. PID. PID is pelvic inflammatory disease. Pelvic inflammatory disease. And this infection, PID, can be caused by a number of bacteria. We can have chlamydia and gonorrhea. So this infection called PID can be caused by a number of bacteria like chlamydia and gonorrhea. This tells you that STIs, sexually transmitted infections, can also cause damage to the fallopian tubes, because gonorrhea it's a sexually transmitted bacteria as well as chlamydia. So infections. We can also have previous ectopic pregnancy. So if this woman has a previous ectopic pregnancy, or at some point she had ectopic pregnancy, this increases the chances of damage to the fallopian tubes. The other thing that can cause damage to the fallopian tubes can be surgery to the oviduct and surrounding pelvic organs. So another cause of damage to the fallopian tubes is surgery to the oviduct and other surrounding pelvic organs. So if this woman has ever had surgery to the tubes or any other organ of the pelvic region, like ovaries, then this increases the chances of damage to the fallopian tubes. We can also have another cause of ectopic pregnancy. It is hormonal imbalances. So if a woman has hormonal imbalances, this means the functionality, the physiology of the fallopian tubes is going to be affected, and also the movement of the fertilized egg. Another problem could be structural abnormalities. Structural abnormalities, I mean, we may have abnormalities in the fallopian tubes. So if the tubes are not well developed during embryology, the tubes did not grow very well, then we may have problems. We may also have growths, stroke tumors. So if we have growths in the tubes, definitely we are going to have damage. Not damage, but this is going to increase the chances of having ectopic pregnancy. The other thing is maternal factors. That is the age. Maternal factors like the age increase the chances of ectopic pregnancy. And this is precisely any woman who is above 35 years. Any woman who is above 35 years of age has higher chances of having ectopic pregnancy. The other factor could be, let me say, lifestyle. Let me say lifestyle factors, e.g., smoking. Some of the lifestyle factors, like smoking, increase the chances of ectopic pregnancy. Maybe I should state one more. We may have so many factors that can cause ectopic pregnancy, but let me mention one more. That is use of contraceptives. That is IUCD. And also, if a woman has ever had BTL, I'm going to explain. Use of contraceptives. For example, IUCD. IUCD is what is commonly referred to as coil. Coil is a long-term method of family planning, contraceptive, and it is inserted in the uterus. It is inserted through the vagina all the way to the uterus. It forms a T. It's like a T. It's like this. So it is inserted in the uterus, the fundus of the uterus, to act as a method of family planning. How? It releases copper ions. It releases copper ions that can increase the thickness of the cervical mucus and other mechanisms. So this is a long-term method of family planning. But do you know that a woman can still conceive while she is on IUCD? Although it's a very rare scenario, if it happens, it increases the chances of ectopic pregnancy because it is occupying the uterus. The part where the implantation should take place is occupied by the coil. So it increases the chances of ectopic pregnancy. What about BTL? BTL means bilateral tubal ligation. Bilateral tubal ligation is whereby we have two fallopian tubes. This can be cut and this can be cut. to act as a permanent method of family planning. So if a woman has BTL, although this is also a rare scenario, she can still conceive, but in rare circumstances. But when this happens, it can increase the chances of ectopic pregnancy. I hope we are together up to that point. Now, I want to mention something very interesting. Just hold on a minute. I want to mention something here, that as much as we are saying ectopic pregnancy mainly occurs at the fallopian tubes. By the way, ectopic pregnancies that occur at the oviduct, ectopic pregnancies that occur at the oviduct account for about 90 to 95%. They account for about 90 to 95%. But as much as we are saying most of the ectopic pregnancies occur in the oviduct, we may also have other areas where ectopic pregnancy can occur. So we have other areas or other regions where ectopic pregnancies can occur. We may have in the cervix. Ectopic pregnancy can occur in the cervix, can also occur in the abdominal cavity. We may also, it can also occur at the Caesarean section scar. It can occur where CS was done, that part, it can occur there. We may also have in the ovaries. Fertilization can occur, and then implantation is diverted to the ovaries. So we are saying, apart from the oviduct, or rather the fallopian tube, these other regions also are potential sites for implantation for ectopic pregnancy. In the cervix, in the abdominal cavity, in the Caesarean section scar, in the ovaries. We can also have ectopic pregnancy occurring there. So I don't know whether we are together up to that point. Now, allow me to discuss about the clinical manifestations. The clinical manifestations, or rather, the signs and symptoms. The signs and symptoms of ectopic pregnancy. The signs, or rather, the clinical manifestations. Or rather, how would you tell that a woman has ectopic pregnancy? What are some of the signs and symptoms? Number one, we have vaginal bleeding. Vaginal bleeding that is different from the normal menses. In one of my videos, I discussed about the normal menses, characteristics of normal menses. So, one of the clinical manifestations of ectopic pregnancy is vaginal bleeding that is different from the normal menses. We may also have sudden, severe, abdominal or pelvic pain. So we may have sudden, severe abdominal or pelvic pain. And in most of the times, it is one-sided. One-sided. Pain in one side of your abdomen, yeah, We may have that kind of manifestations. The other thing is we may have shoulder pain. And this shoulder pain is referred to as referred pain. It is called referred pain. Why? Because this implantation in the tubes can rupture. So once it has ruptured, it can cause internal bleeding. It can cause internal bleeding that can exert pressure on the diaphragm. So once pressure of the internal bleeding has been exerted on the diaphragm, definitely we are going to have the shoulder pain. It's called referred pain. So the other thing could be dizziness and even fainting. Someone can feel so dizzy and can have some signs of, can faint because of this, the internal bleeding itself. So the other manifestation could be signs of shock. What are some of the signs of shock? What are some of the signs of shock? We may have rapid pulse. This is increased heart rate. We may also have low blood pressure, among other manifestations. So these are signs of shock: rapid pulse, low blood pressure, and what else? What else? We can have loss of consciousness, LOC, loss of consciousness because of the internal bleeding. Now, these are the clinical manifestations. I want us to look at why can ectopic pregnancy lead to death? Why can ectopic pregnancy lead to death? This is what I want us to look at. Yes, how can ectopic pregnancy lead to death? How can ectopic pregnancy lead to death? So number one, it can lead to death if the tubes have ruptured. If the tubes have ruptured, leading to loss of blood, severe loss of blood, that is internal bleeding, this loss of blood will precipitate signs of shock, as we have mentioned: low blood pressure, high heart rate, and also hypovolemic shock. So this loss of blood, the internal bleeding, can lead to low blood pressure, increased heart rate, and also the hypovolemic shock because the tubes have ruptured. Now, the other way is delayed diagnosis. If this ectopic pregnancy has not been diagnosed early enough, that means it is going to advance, the tubes are going to rupture, and all these things are going to happen. Loss of blood, all these, what we call the hemorrhagic shock. The hemorrhagic shock. So how else can this lead to death? Inaccessibility. I'm going to explain this. We said it is not only in the oviduct where ectopic pregnancy can occur. It can occur in other regions. And one of the regions is the abdominal cavity. So if this ectopic pregnancy has occurred in the abdominal cavity, the nature of bleeding that comes from the abdominal cavity may not be easy to be controlled. So inaccessibility means the inability now to control, to arrest bleeding that is coming from the abdominal cavity. So we may also have hemorrhagic shock, and this is as a result of the internal bleeding. Severe blood loss can lead to hemorrhagic shock. And also, let me say this, the loss of blood, low blood pressure, increased pulse rate, hypovolemic shock, this will lead to hemodynamic instability. So all these loss of blood, low blood pressure, high pulse rate, hypovolemic shock is going to lead to hemodynamic instability, meaning the hemodynamic status of this patient is not stable because the pressure is low and all these other manifestations. So this is how dangerous it is. So for it to be managed early enough, early diagnosis must be made. And also, if there are signs of rupture, then the appropriate management should be administered. I'm yet to discuss about the management, and that is where we are heading to. That is where we are heading to. How can we manage this ectopic pregnancy? How? How can we manage this ectopic pregnancy? The management. I'm looking at the management of ectopic pregnancy. Now, for small ectopic pregnancies, which are less than 3.5 centimeters, and the patient is stable. So if they are small, less than 3.5 centimeters, and the patient is stable, then we can use a drug, methotrexate. So this methotrexate can be used to arrest the growth of this ectopic pregnancy, the growing tissue. We can use this methotrexate. However, surgery can also be an option. Surgery can also be an option. I'm going to discuss the two types of surgeries that can be done. So this is for the small ectopic pregnancies, which are less than 3.5 centimeters. We can do what? We can administer this drug, methotrexate. So for larger ectopic pregnancies, and these are greater than 3.5 centimeters, the patient is not stable, then we are going to use surgery. I hope you are following. For larger ectopic pregnancies, which are greater than 3.5 centimeters, the patient is unstable. Unstable means the patient may be having severe internal bleeding and all that. Definitely we are going for surgery. And lastly, for ruptured ectopic pregnancies, irregardless of the size, meaning this size doesn't matter if the ectopic pregnancy has ruptured. So for the ectopic pregnancies that have ruptured, irregardless of the size, and the patient has severe blood loss, then we should go for immediate surgery. We should go for immediate surgery, regardless of the size of the ectopic pregnancy. So this is how we manage ectopic pregnancy, depending on the size and depending on if they have ruptured. Now, I want us to look at the two methods We are almost winding up. So, what are the two types of surgeries that can be done? What are some of the two surgeries that can be done? We can have laparoscopic surgery. These are for small and stable ectopic pregnancies. For the ectopic pregnancies that are small and stable, then involves use of small incisions. Small incisions are made, and a camera is used. A camera is used to guide the removal. So small and stable ectopic pregnancies, small incisions are made, and a camera is used to guide the removal. So the importance of this is it is less invasive. It is less invasive because small incisions are made, and this has quicker recovery time. This is less invasive because of the small incisions, and it has a lesser recovery time. Now, this is laparoscopic surgery. Now, we can have laparotomy. Now, this is for ectopic pregnancies that are larger. These are for ectopic pregnancies that are larger, and therefore larger incisions are made. Larger incisions are made, and this is larger and more complex cases. So these are for larger and more complex cases, and it is done whereby, or rather it is done when the ectopic pregnancy has caused massive damage to the tubes and severe internal bleeding. So this is done for larger and more complex cases. Larger incisions are made, and it's done whereby the ectopic pregnancies has caused massive damage to the tubes that we mentioned here, and there is severe internal bleeding. So these are the two types of surgeries that can be done. But I want to remind you this. For small and stable surgeries, methotrexate can be used to arrest the growth of that ectopic pregnancy. So these are the surgical options that we have. So I hope we are doing well. And lastly, I want us to look at now the prevention. How can we prevent and control the occurrence of ectopic pregnancies? How? So I want us to look at the prevention. One, regular prenatal checkups. Pregnant women should have regular prenatal checkups, because these checkups are going to rule out if the implantation is in the right place, in the right position, and if there are abnormalities. So regular prenatal checkups. We can also do public awareness on the risk factors and also signs and symptoms of ectopic pregnancy. We have to create awareness to the masses, to the people, that when you see these, these are the types of risk factors that can predispose you to ectopic pregnancy. And when you see these signs and symptoms, they may suggest that you may have ectopic pregnancy. So we have to create public awareness. This also is going to do these regular prenatal checkups will help us in having early diagnosis. Because we said delayed diagnosis can lead to death. So early diagnosis. When this ectopic pregnancy has been diagnosed early enough, it's going to be managed, definitely. Then risk factor management. All the potential risk factors must be managed. Like smoking is one of the risk factors, should be managed so that we don't have this scenario occurring. Then we have 5, specialized care to mothers with previous ectopic pregnancy. Those mothers who have ever had ectopic pregnancy should receive specialized care, attention, and the correct awareness that they need to know, they need to understand, they need to be given a specialized care, because having history of ectopic pregnancy is a risk factor to ectopic pregnancy. We may also do lifestyle modification. We have to do lifestyle modification, like quit smoking. Quit smoking and other risk factors. Quit smoking and other risk factors. So modify your lifestyle. And lastly, but not the least, we should have prompt medical intervention. We should do a prompt medical intervention immediately we diagnose ectopic pregnancy. A prompt medical intervention should be given. We should be able to assess the client whether we should give methotrexate or the client is able to undergo a surgery. Of course, there are contraindications to surgery, like the age is also a factor to consider. If the patient is stable or not stable, there are contraindications to surgery. So we have to assess the client and know what kind of medical intervention she deserves. So these are some of the prevention and control of ectopic pregnancy. And this brings us to the end of our presentation. So this is ectopic pregnancy. I've discussed the anatomical part of it, the statistics, the etiology, what causes it, other parts where ectopic pregnancy can occur, the risk factors. I've discussed about the management, the types of surgeries, and also the control and prevention of ectopic pregnancy. This is a very crucial topic because it is one of the leading killers of our mothers in the world. So we have to sensitize our mothers and the general population on ectopic pregnancy. But please don't ignore any sign. If you see any sign I mentioned here, please don't ignore. You have to take action and visit a physician. In Swahili we say, maumivu yakizidi muone daktari, but usingoje hadi maumivu yakuwe mengi ndo uone daktari. So ukiona hizi signs ambazo nimesema hapa, please make an attempt of visiting a physician. So until next time, you have to enjoy this interesting topic. So if you have a question, the comment section is open. I am ISHMAEL MBITHI, the founder and the director of Mtumishi ISHMAEL Volunteer Youth Talks, one of the leading initiatives in creating public awareness to our general population. God bless you.